Nothing in your plan mandates healthcare. You hope that incentives will be enough to encourage everyone to be insured. And you say that the best way to be insured is to hold a job. Well, when I was in middle school, both of my parents worked, and so we did not qualify for Medicaid or any other government plan, and yet I was not insured, and I got sick. For months and months, I could not see a doctor because we couldn't afford it. I missed school, my grades slipped. And so I ask you, two-part question, sorry. Have you ever been sick without health insurance? And the second part, why should any child be made to suffer their parents' experiences in life and their whatever conditions led them to not have insurance?
I appreciate that. First of all, no. I don't believe in mandates. Mandates that require you to purchase something that common sense ought to say you ought to do. Yes, I was sick one time while being uninsured and had 3 kids while I had no health insurance. I had an income that was low enough, I couldn't literally afford that. I have a scar, and I won't raise my pants, that scare a lot of people, but I have a scar right here from a chainsaw when I was cutting wood to heat my house. And I didn't take time to adjust the chainsaw, and I was sitting on the side of a fence row and came down with it. And needless to say, my wife passed out when I came home and said, help me fix this. I didn't have insurance. Fortunately, it didn't cut to the bone, and I was able to cleanse it and butterfly it, and though I don't look good in shorts anymore, yet we survived it. Was it stupid? Maybe. But sometimes we do things we have to do, and we try to work hard to the point that we have health insurance. I have health insurance. My kids have health insurance. Now, on their own, as adults, they've made those choices. Kids all over this country suffer as a result of bad decisions from parents in a lot of areas. I wasn't a perfect parent in raising my kids. I made mistakes with them. But thank God they survived. And I'm glad you survived. And I hope you don't have to go without health care coverage. But I can tell you that if you want the health care coverage that Canada, Great Britain, other countries with socialized medicine has, you have been sold a bill of goods without information. And the fact that our people in emergency rooms get better care, more immediate care, than people in the Canadian healthcare system who come across the line to America to receive health care. So, yes.